Hi, I'm Dr. Grant Williams. Today we're going to be talking about a subject which I know you're all interested in, and that is stem cells. I want to let you know a little bit about my background with stem cells so that you may have some confidence in what we're talking about. I'm a board certified member of the American Academy of Stem Cell Physicians. I've been doing stem cell treatments for about 15 years, since about 2010. And I joined the Academy in the last 4 years and became board certified because they are a great group of people that want to share information, share knowledge. And if you're a doctor out there and you want to have more knowledge about stem cells and those treatments, I would look them up and start coming to some of our training sessions. With that said, we're going to talk about 5 myths and 5 facts that surround them, also known as the 5 and 5. Myth 1, stem cell therapy can cure anything. So are stem cells able to cure anything? No, they're not able to cure anything. Stem cells are basically helper cells, and they can help a lot of the body's systems work better because as we age, we decline the number of stem cells in our body, and we have less resources to repair and heal things in our body. Stem cells come in handy to heal things like cartilage loss in a knee. Probably joints are the most beneficial thing that stem cells are used for, but also systemic disorders, diabetes, heart disease, they can be useful for those things. But for instance, in the epidural space, they've shown not to be very good in an epidural, not as good as steroids, not as good as PRP. There are cost-benefit ratios with all things, and so we want to use stem cells what they're best for, and that's what you want to consult with a specialist that really understands stem cells and where they can be beneficial and where they can't be, so that you understand how those ratios of cost versus benefit come into play. Myth 2, stem cells are all alike. So are all stem cells alike? Well, our sources of stem cells are varied. We can get stem cells from our bone marrow. We can get stem cells from our adipose tissue, which is basically through liposuction. And we can get them from umbilical cord blood from newborn babies and the placenta. We take the umbilical cord and placental material that would otherwise be discarded after cesarean section babies, because it's a controlled situation. And those cells can be harvested and utilized, usually frozen, cryogenically preserved for future use. The advantages there are that they don't require a procedure that puts a crack in your bone to get bone marrow, or has liposuction, which has its own risks. It's readily available, and you can use larger quantities of cells as much as you need without any trauma to your body. Larger volume of cells, larger benefits that you can get. They're also purified and centrifuged so that you can actually use them IV for anti-aging benefits as well. So you can tell where my bias lies a little bit, but all are useful and all are effective for their own purposes. Myth number 3, stem cell injections are risk-free if they're from your own body. Are stem cell injections risk-free if they're from your own body? Well, you have to consider that you're actually getting them from your body, and so you have to harvest them, which is a process which carries its own risk. Entering the bone marrow and having to go through the outer cortex of the bone to get into the bone marrow is a process. Whenever you're going from the outside world into the body, that has a chance of introducing infection. There can be bruising, and that bone has to heal, and everyone heals at different speeds. So that carries its own risk. The other thing that we have to consider is the risk of injecting back in, because it's outside the body, being processed, being centrifuged, and we try to use the best sterile technique possible, but there's a chance of introduction of infection. And if you put that into a joint, say a knee or a hip, then we're risking some infection in that area. Also, liposuction, same thing. We're entering the body, we're getting the fat cells, and we're processing them, spinning them down. That processing could also carry a risk of infection, and we have the time to heal. And that healing, if it goes normal, it's great. But if it doesn't, there could be a problem as well. Also, we have to consider the age of the person and the potency of those possible stem cells and the quantity, because as we get older, we have much less in the way of numbers of stem cells in our body. And so our own sources can be a lot less. And there's not really a way to measure that. We can do a culture counter or some sort of counting. Even they make devices for the office, but those cell counts are measuring all cells. They're not necessarily measuring the cells that are the stem cells, the mesenchymal cells, the cells that actually do the work. So again, stem cell injections are not risk-free if they're from your own body. Myth 4, stem cells come from aborted fetuses. So this one's a little more serious. Do stem cells come from aborted fetuses? And there's a lot of times where I'm sure there's a conversation around a dinner table, and there's many beliefs out there about abortion, and I don't want to say anything about the beliefs on either side. But when we're talking about umbilical cord stem cells, we've already talked about the adipose stem cells and the bone marrow derived stem cells. Those come from your own body. So of course, those are not from aborted fetuses. But we've already alluded to the fact that stem cells derived from umbilical cord blood are from the umbilicus and the placenta, which are discarded products after birth. That's why they're often termed the afterbirth. Those are instead saved, utilized, put on ice right away so that the cells are vital, and then processed to gather the stem cells out of them. In the past, you've probably heard of people talking about saving your cord blood or saving your umbilical cord for your own child's stem cells. That's basically what we're using, except we're using them more actively and we're using them as an allograft sort of situation. So no, stem cells do not come from aborted fetuses. That is not ethical. Myth 5, the best stem cells come from abroad. Yeah, right. So are the best stem cells from abroad? I think that there are good sources abroad. It's just the unknown. The unknown about what was the lab like that prepared them? What sort of quality standards did they have? In the United States, we're only harvesting cells that are available and concentrating them, minimally manipulated. In cells that are sourced from abroad, there may be a high level of manipulation that goes on. Does that mean the cells are better because they're able to be manipulated? Not necessarily, because cells can only divide so many times. When we isolate them and put them in your body, they are at no cell divisions, and so they have a lot of life left in them to divide and to multiply. For instance, if you get 500 million cells from another country, wow, I got a lot. We're getting cells that might have started out as 10 million, and then they doubled and went to 20 million and so on and so forth until they got to 500 million. But all those cell divisions are used up and may not have much more capacity to grow further. The quality of the practitioner you can look up, you can follow in this country. And oftentimes a practitioner that's gone to another country is because they've been banned in this country. So you have to watch out for things like that. The United States is a great place. My clinic is a great place. I source great cells with good potency. If you're looking for a source of great stem cells from the United States, I think I know a guy. Hope you enjoyed this episode. Leave a comment if you have any suggestions for future topics. If you have any questions about stem cells, check out my website in the description below. Be sure to like and subscribe and turn on notifications so you never miss any future videos. Until next time, stay safe, be well, get your stem cells, and love your family.